to A1 Insights, the home for candid nursing conversations. Today, we're highlighting a new program, A1 Perinatal Education Exchange, or APEX, and speaking with the team that traveled in August 2024 to the Republic of Trinidad and Tobago in the Caribbean. The focus of their visit was to train nurses using simulation techniques from A1's Obstetric Patient Safety Program and was led by one of A1's newest fellows, Dr. Kandis McLean, in collaboration with the Trinidad and Tobago National Nurses Association. Our guests are Avion Drayton-Bailey, first Vice President of the Trinidad and Tobago National Nursing Association, Katrina Johnson, member of the A1 Board of Directors, Dr. Kandis McLean, a maternal health nurse executive and director of nursing for New York State Planned Parenthood, Ashley Rainey, clinical director for Women, Children, and Family Commission for the state of Indiana, and two guests that were unable to join us today, Dr. Danielle Jones, Vice President of Accountability, Belonging, and Culture at A1, and Matthew Medina, member of the 2025 A1 Board of Directors. I'm Bria Anopise, your host, and I'm joined by co-host Susan Hale, Director of Critical Care Clinical Programs at A1. Susan, I'm now turning the podcast over to you.
Thank you, Bria, and welcome everybody. So Kandis and Avion, what was the driving factor that made you decide to take the A1 OPS OB emergency workshop over to Trinidad and Tobago?
Hi, good day, Susan. It's a pleasure to be on your podcast today and to speak about this. It was an honor to be able to start this initiative for global health and maternal global health as a focus. Well, what started it off was the loss of my cousin in 2020, who had a poor maternal outcome and death in Trinidad San Fernando Hospital. I was born in the country of Trinidad and Tobago, so I thought when I got my first health equity grant from my college as a teaching assistant professor to carry it over to my home island and collaborate with the Trinidad Nursing Association. I was more than honored to meet with Avion Drayton-Bailey, the first vice president, who started the initiative and really just carried the torch. So we were able to carry this forth and started to collaborate so we can get 35 midwives to attend the session and also arrange for transportation. I'm going to invite Avion to also share some details about how we united with the Trinidad Nursing Association.
So thanks, Kandis, and it was a pleasure to host the AWHONN team in Trinidad and Tobago. We were really honored to have you all come and to meet with our nursing personnel and give them that insight into obstetric emergency. We decided to partner with AWHONN because we would have had incidences before with maternal deaths, and it has been one of the driving forces with our Ministry of Health to ensure that our maternal deaths remain at zero. So I felt that as first vice, my role is for professional development. I felt that it would have been an awesome opportunity for our nurses to get that insight into obstetric emergencies to ensure that, we have zero mortality in our delivery rooms.
Thanks, both of you, for giving that insight. Avion, what educational resources do nurses in your country currently use or do they have?
So we have a lecture-based teaching dynamic. Yes, we do have simulations, some online activity where we would do videos and quiz and games. We also have our practical sessions. Our nurses, they spend a lot of time within the hospital area itself, getting that hands-on experience at the hospitals. And then, of course, they would have their final exams. But we really felt that this program would have given a different dynamic into the way they learned. Kandis utilized a lot of games and so forth and made it really fun. So I think that helped them to really understand and grasp different concepts.
Yes. So, Candace, how did you decide or select the team of instructors to go with you to co-teach?
So one of the awesome things about being part of AWHONN is able to collaborate and meet so many different people. The awesome thing about the team of educators is nobody is from my home state. I have met these women doing awesome work through AWHONN in promotion of maternal health. Katrina is a perinatal health care specialist, safety officer in her region. So thus, and also an OPS instructor already. And it was more than able to connect and collaborate and say, hey, let's come on board and do this trip. Ashley Rainey is also a director in her state for maternal health and promoting it on a large scale across the state for people to utilize the simulation court for better outcomes and to reduce the adverse maternal rate in the rural area of Indiana. So, using these specialties, it was more than just a perfect dream team to literally carry out this educational force. And unfortunately, our partner, Matt Medina, who's also a partner and director at AWHONN and a clinical nurse midwife, was part of the trip. So, using all of our specialties and knowledge and clinical expertise, it was just a perfect team of educators to go out and carry this mission.
You did a great job picking the instructors to go with you. So, let me ask you this question: what did your team need to do to prepare for the trip and to teach the workshop? And then, when you're done, Avion, if you would let us know what the nurses had to do on their end to prepare for the instructors to come and teach.
So a lot of work went into carrying out this mission. We met several times, coordinated meetings. The educators wanted a structured schedule so we know what components of the course that we needed to deliver. So that was fit best to whomever felt, hey, this is my specialty to cover preeclampsia, or I feel comfortable doing the simulation room, which was run by Ashley Rainey. So we chose the special components based on what we were comfortable with, but that takes collaboration and time dedicated outside of actually delivering the course. We would meet bi-weekly, and Avion was very instrumental in ensuring that we had the adequate teaching space. So we need to make sure that we had a facility that can actually be adequate to deliver the space, have a simulation room, and capability to deliver didactic. We were provided internet connection, and also transportation was provided by the Trinidad Nurses Association. So we were very comfortable to deliver the course in a different country, but utilizing some of the similar resources that would be necessary to carry it out in the United States.
Sounds like a lot of coordination was taking place. Avion, what about on your end, the preparation that for what you had to do to gather the participants for the workshop?
Okay, so our association, we also have some media pages. We use social media, and we have a wild apricot where we send out messages to our members. So very early in collaborating, we would have sent out the information letting them know that we have this group of specialists coming to do obstetric emergencies and, build interest. We would have also reached out to the different regional health authorities and asked the CEOs to sponsor nursing personnel so that they can attend. And we did not only focus on midwives, but we also had our registered nurses and enrolled nursing assistants, the entire team that would be working in a maternal and childcare environment. So we were able to get a good mix. And we also reached out to our private sector, and they would have sent two nurses from one of the female hospitals to participate.
Definitely a lot of coordination that took place. So, as we know, practicing as a team makes a world of difference. So, were the participants in Trinidad and Tobago, were they all nurses? And if they were all nurses, do you think that the providers would be willing to participate in the workshop as well? So maybe Ashley and Avion, if either one of you would like to answer that.
Sure. So we had 32 participants in all. We would have had 35 persons registering, but only 32 showed up on the actual day. And of that 32, three were enrolled nursing assistants. Or I think they are equivalent to your CNAs. So they actually work within the department. They are not midwives, but because we know that they have to work as a team, we felt that they would also benefit from the knowledge so that they can relay information and understanding of what's going on. And they themselves would have given us feedback that they really enjoyed the session and they felt that they really had some good takeaways, you know? So, in addition to midwives, we had registered nurses and enrolled nursing assistants.
Thank you. Go ahead, Ashley.
I was just going to add, I think one of the big things that what was really interesting and influential about this class is, yes, they were all nurses and midwives, but we also had ICU nurses there, which really made it
Yes.
dynamic. It's something that you typically do not see when we're talking about this course, and it made us all really think strategically about when we're promoting for opportunities here throughout the United States, the importance of having those other clinicians, because honestly, not only did we have the opportunity of engaging them with education, they provided us a lot of insight, particularly when we
Yeah.
were seeing certain acronyms, and the ICU nurse that was there was, able to go more in depth. So it was really meaningful to be amongst not only the midwives, but the registered nurses and assistants, but also looking at the different disciplines or areas of focus that were represented.
And let me just put in that you all would have also had a nursing educator from the university as well. She was there, part of the training.
Does make a world of difference when you have different disciplines. So, Katrina,
Mm.
sure, we take things for granted in the United States. Given the different availability of resources and the different culture, what modifications were needed when teaching the workshop?
Some of the things that I noticed was some of the medications that we use and the names that we use here in the United States were different. It was the same medication, it acted in the same way, but the name of it was different. How they used it was the same. Um, I think what really impressed me the most was the amount of communication between the patients and the providers. I think that was one of the major things is that with school with the classes, just connecting with the nurses. It was one young lady that was a NICU nurse that when I was doing the overview for NRP, we did just like a brief overview, just kind of level setting as far as terminology, medications, where certain things were done. Like we would do certain things in our delivery rooms where they would take the baby to the NICU. So just kind of like level setting and see where all those activities would take place.
Do you think it made it more difficult to teach or to relay some of those teaching tips when their processes were different?
No, because we had great discussion. It was great communication. They were very open to what we were saying, and we were open to what they were telling us. And then just kind of bridging that gap between where we do things here in the United States and where they do things there is not so much where you do it, is that you know what you're doing when you're doing it.
Ashley, what about you? Did you find any difficulty in the flexibility of changing to suit maybe their processes and their protocols? Was it just we're just going to be flexible here and go with the flow? And
Yeah, I would echo everything Katrina stated. It was a very collaborative class. We had a lot of ongoing discussion where we can better understand their workflow, which allowed us to adapt fairly easily. One of the big things that we learned, which was very eye opening when we were talking about, the structure of the unit, we learned that, the midwives typically do most of the work. Where here, when you're talking about the U.S. not understanding the advantage they have, we're used to having 3, 4, 5, 6 nurses and doctors readily available and all these other additional people to assist us with the workflow where typically it may be 2 or 3 individuals on the floor. They may have, as Katrina stated, that neonatologist who come, but they don't bring a whole NICU team. And so it really opened my eyes and perspective of we are easily to justify why we can't do something here in the USA where they were more in the mindset of we can do whatever we put our mind to, and we're not going to take advantage or look at the areas of gaps and say, because we don't have this, we can't do it. They made a way to ensure they were
Exactly.
given great care. So for me, it was not so many modifications needed, but more of an understanding of their workflow so that we're speaking the same language when we're trying to educate and provide insight to them. So that's my take on it. Candice, anything additional you would like to add?
No, what you're speaking is so powerful because we do get very complacent in the United States to not really appreciate the resources that we have readily accessible. Versus going out to Trinidad, we were granted the opportunity to go to a local hospital and to see how they do clinical and their local resources. So, one of the great things in addition was during their maternal care, they're immediately sent for testing and if they have HIV risk or exposure, similar to the processes that we have in the United States. But to take it even a step further, Trinidad now, if the person does test positive, they're immediately connected to the Ministry of Health. So they're provided free medication and continuous services, and they're checked on by the government health officials. Even though we have these processes in place, it was great to see it in a different country. Some of the things that we can also adopt here and carry forth to make sure that there's no gaps in care and continuity of care. Because now we can prevent babies from being birthed testing HIV positive and keep their CD4 levels low if we had such initiatives that were continuous. If the person doesn't show up at the Ministry of Health, then they pay a home visit. So that was an awesome opportunity to be granted the opportunity to go into the hospital facilities as well. So, like Ashley, I really echo what Ashley says that it's great to be able to go to another country and see what resources they have accessible, but how they maximize on what they have available to them.
And
I
I'm
Can I
sorry, I just
piggyback
wanted to
on that
add.
also?
Oh, go ahead, Katrina.
Go ahead. What I found that was really interesting when we were talking to the lab physician, she was saying that if the partner didn't come in, that the pregnant woman could take one of the HIV tests home, swab the partner, and then take a picture and send the results in. I felt like that was just going way beyond and above what needs to be done. It helps the patient to have responsibility for her own health, and then also looking at how we can eradicate or reduce the transmission. So that was like amazing to me. I'm sorry, Ashley.
No, you're fine. You can hear our excitement when we are reflecting back on the opportunity of being there. And so for me, speaking about the hospital, one thing that stood out to me when we're talking about modifications or education and the U.S. taking things for granted, we do a lot of discussion about, I'm going to do air quotes when I say this, non-compliance or individuals not being accepting to breastfeeding. One thing I noticed when we reflect back on our visit to the facilities, the hot birthing hospitals, they did a great job of educating their patients from the moment they
Yes.
arrive, not when they walk in. We pulled up and we seeing baby friendly signs. We seeing signs about
Yes.
breastfeeding. These are things that's in the lobby, big pictures of the steps and their acknowledgments and what they're committed to doing posted everywhere. You can have QR codes. They have QR codes about, SIDS and breastfeeding and so many things that we were even taking pictures ourselves saying, hold on, how do we
Yes.
replicate this? So I commend Trinidad and Tobago because they are taking the steps to educate. They don't wait until the time of discharge. As we say, speaking as an educator myself, that's my background's nursing education. Well, education starts the moment the individual finds out they're pregnant. We cannot
Mhm.
expect that the time of discharge they are retaining and understanding the amount of information we are providing. So they are doing their step, an opportunity of educating the women and the father and partners throughout their country of understanding what is it, what's important, why it's important from the moment they conceive. And I commend you guys for that.
Mhm.
It sounds like you all have not only taught a lot of knowledge and skills, but also received a lot of knowledge and skills just from going. And a question for any one of you for everything that you learned while you were there, anything that you would change in the way that you're presenting the OB emergencies workshop whenever you're in the United States? Is there something that you would incorporate when you're teaching within our from what you've learned over in Tobago or Trinidad, and you would change things the way that you approach how you're teaching the OPS program in the United States?
I don't mind kicking us off, and the only reason why I say that is because, if you're not aware, Candace and I, have, some courses coming up, here in Indiana, and even thinking about my most recent trip to Trinidad and Tobago, for me, it's really, grasping the understanding, and level setting that individual knowledge, right? It's easy for us to assume that individuals have been working in this space for a long time, so they automatically know. But I think really taking the time to have deliberate discussions about the different workflow, and being able to entitle things in, but then also sharing, right, the difference of what we've seen in other countries and how does that translate when you're talking about, other individuals coming over and they are, living and migrating to the US. What does that mean? Being aware of the cultural differences and how that plays a big, big factor. So it just opened my eyes, and I do plan to integrate more of those lived experiences that I was able to encounter when being in Trinidad and Tobago into my teaching.
I wanna piggyback off of, Ashley, I agree, because we in the United States are such an entitled country, and just looking at the resources that Trinidad did not have, that we have, but they made a way. I was looking at the paper documentation, and I always joke with the younger nurses here, I'm that red, green, and black um, nurse when we used to document on paper in the different colors because we worked 8-hour shifts. But they, even though they did not have electronic documentation, they were very thorough in their paperwork, making sure that everything was where it was supposed to be. The right people had the right paper at the right time. And it was just, it was seemed so seamless. It seemed just like it was like water flowing down a river. It was nothing there to impede that. And I really looked up to them for that because, managing a bunch of paper is a big thing. And they did it with a lot of ease.
So Avion, let me ask you this question, and then Katrina, if you piggyback off of Avion, what feedback did you receive from the participants? Did they share any takeaways, things that they wanted to incorporate into their practice? And then Katrina, maybe share some feedback while you were there that you may have obtained from some of the participants.
Yes, well, these students, they were very excited with the information that they got, and they felt as though Candice and team needed to come back every month and do something different, you know? So they were so excited. But, one of the things that I kept seeing repeated over and over is suturing. Um, our nurses are really excited and they want to do suturing, but our scope of practice at present does not allow us to suture. So the midwives, they do full delivery, but once there's an episiotomy, the doctor has to come in to suture. And sometimes, the patients remain sort of exposed and are waiting for the doctor to come. And it's one of the most something that the nurses always feel that if they had that opportunity to suture, that they would be able to complete the entire process for the patient, that they can go forward to relax with their new baby. So we have already approached the Nursing Council of Trinidad and Tobago to see if they can include suturing in our scope of practice so that when Candice and team continue the course, our nurses would be ready to go forward. So they are excited about suturing and of course other little things. They wanted to do some intubation of the newborn, shoulder dystocia, um, IV cannulation, phlebotomy, things that could occur during, you know, the birth and delivery that we normally have to call the doctor to do. So those are the things that they have expressed interest in.
Candace, you got a
And
list going, right?
a
I
whole list.
definitely do.
Katrina,
Yes.
any feedback that you picked up while you were there?
Yes. Oh my God. Great conversations with the nurses and the midwives. Just the conversation that we had with the ICU nurse. I learned so much from her about lab results, and it was a specific lab draw that they did to for infection. And I had never heard of it. We looked it up and it was amazing. And just working with a couple of pictures online, a young lady that worked in the NICU. I had asked her to come up with me and just kind of do some things with the baby with when we were demonstrating techniques with NRP. And she was like telling me, "Oh yes, we do the same thing." It was just the feedback and just knowing that yes, some things are different, but pretty much everything is the same and we want the same outcome. We want our moms and our babies to survive their labor and birth.
Ashley or Candace, any feedback that either one of you picked up while you were there that you want to share?
So they definitely have been continuously reaching out. One of the great things with collaborating with them, to know when we were coming back next time. But they were highly interested in learning about fetal monitoring, the A1 fetal monitoring course, and hearing how we teach that over a composition of intermediate, doing advanced. A lot of people are like, oh, that's so much investment into your nursing component. So there's also ability to bring that there also as well as Trinidad through the A1 Association. We've been getting so much positive feedback. It was a pleasure when they met the whole team. With Katrina as an educator for neonates as well, they were highly interested in neonatal resuscitation. So that certification as well, which we do in America, we can also help to invest it over there in Trinidad as well when they look in NRP and what do we do to be able to better resuscitate our babies? That's our standard of care. So were curious to what certifications do we need to maintain a competent maternal health nurse here. So the exchange of ideas and opening their scope of practice. And as Ms. Avion just mentioned about the getting them to get suturing in, as a nurse practitioner in New York State, that is in our scope of practice. And Matt doing midwifery and our team in general, nursing, registered nurses can suture in the United States. So that is a limitation that we hope to really bring back the whole entire team to help them bridge that to get that skill with suturing, learning figure eights. How do you close a vaginal appease? Nobody should be waiting 30 minutes for a vaginal laceration that literally could be sutured. And as the nurses made the joke, many of us so close. Come on, what is it to suture? So we were laughing because it's quite a skill, but it's just the ability to be able to rightfully do it under the scope of practice in Trinidad is the concern.
And I would just add to that, thank you both. First off, it was the procalcitonin and sepsis, PCT, I remember. I remember exactly what it was. But one of the things I would like to add from the feedback that I got, I thought it was we all laughed about it, but the acronym CUS, right? And the importance of being able to advocate, right? If you feel something, hear something, see something, say something. And so that's one of the big things that we really spent some time talking about, and we had positive feedback on. And I remember us going in depth about the importance of saying, if you're uncomfortable, then you say, Dr. So-and-so, I am concerned, I'm uncomfortable, and this is a safety issue. And that alone should be able to get you the ability to get the attention from that provider. And I always advocate and I always say there's power in numbers, right? And so if you see something and you see one of your peers is having a challenging time with a provider, you don't really have to say too much. Just you coming and standing beside them, right? Alone will be able to let that provider know, okay, I have some additional things I need to be examining because they're not going to let me leave this unit. They're not going to allow me to leave this patient until I take the time to listen to their concerns. So, a huge thing that I continued to hear when I was there is the importance of the support in being able to properly advocate their needs, such as Ms. Avion stated, the ability to suture so that an individual is not sitting there with their perineum exposed and they can maintain that dignity.
Thank you all. So I hear a common theme going that we all have the same goal is to improve maternal outcomes no matter where these moms are located. So what is your hope or vision for taking the A1 OPS workshop globally? Are there any modifications that we would need to do to accommodate those participants taking it outside of the United States? And if any one of you want to answer that, that would be wonderful.
I would just like to kick it off. One of my dreams of international collaboration is to really see the investment of AWHONN, just how we're embedded in the United States, to embed it in the Caribbean with their educational components. When you do the A1 OPS course, it's based off a simulation, a component of didactic, but also that nice new part of games, right? Teaching people through a different method and way, but reinforcing team dynamics, communication. They're having the same challenges that we face as nurses in the United States: provider communication, debriefing after critical events, just even managing the
Yes.
critical event of an obstetric shoulder or a complication of a uterine rupture, getting to the team in a timely manner, right? So those are components that really share globally, but that we can help because we have the course. So I would really like to see an international branch of AWHONN established through this collaboration. We have the Trinidad Nursing Association. They wish to be a part of us, but I would like us to think of it on an international scale with an international membership that is based on international prices, because it looks different in Trinidad and financial costs compared to United States. Our $200 is a totally different range in United States. So those are things that we need to be financially considerate of if we were to do that, but also just embedding it, getting it in their colleges and hospitals, just as we do here in the United States, to set that standard of care and help them to reduce the adverse outcomes, which they have actually done very well with this year in the promotion of maternal health. But there's, as we say, we want 0% fatality in maternal mortality. We accept 0% with airplanes. Why are we not holding the same standard in maternal health care to really reduce that and have no poor outcomes? So that's my vision for it. And I'll pass the baton on to my team to see, how do you see it?
Katrina?
I agree with that, Candace. I It just makes my heart sing because we were talking about fetal monitoring, and I told some of the ladies, I said, "Listen, if you want me to do a virtual advanced fetal monitoring class, we can do it. I'm willing to get on there and let's talk through it and do a class." And I explained to them what it would look like, and they were like gung ho, ready to go. So just making sure that we level setting, not just here in the United States, but also in Trinidad, Tobago, all our Caribbean countries, because, this is a global effort to keep moms and babies safe. So we just can't say, oh, we're going to do this in the United States. But no, we have to reach out. If we're going to be truly a community association, our community is everyone.
And I would like to add, as we all know, on this call, that Black and Brown women are 3 to 4 times more likely to die during childbirth. And that's including Caribbean mothers who may relocate here to the US. And so when we're thinking about modifications to the A1 OPS course, I think it's imperative that as we're starting to work with these other countries, we're taking into account and we're embedding some of those sort of things into the course, right? So that even when we're teaching it, we're being adaptive to those other cultures who are coming to the US. We are being complementary to what their culture is. And we're being also very mindful of some of the things that we're saying and what we're delivering, because it may not be necessarily true with their culture. I think the other big component when we're talking about taking this to other cultures to teach is, how do we get some preliminary work? Maybe is there a spreadsheet where we can collect and understand their medications, right? Their team dynamic and structures. Because although we had a very fun collaborative team, I felt we took a lot of time to understand, how does things work here in Trinidad and Tobago, right? How can we be reassuring that what we're giving you is going to be conducive and adaptable to your workspace? And so if those are things that we can easily have accessible and know prior to going, then we're also able to have that conversation and our teaching components integrated into our language. And we're not getting those looks that look and go, hold on, I can see that something is off here. And that's what made it more easily adaptable, because we could read the classroom and say, tell me more. What am I not seeing? And they go, well, that's not how it works here. And so just being able to have those kind of documents or things like that already prepared, that we can say, these are some key things we need to talk about and know prior to coming, so that we're giving you our 100% ability to teach based on your clinical dynamic and team structure.
Yes.
That was great, all of you. Thank you so much. I even jotted some notes down. That was really good. Great feedback. I'm glad to hear that not only have you guys instilled your knowledge and skills to other people, but you came back with a lot of knowledge and skills. So I appreciate that. Does anybody have any other feedback or comments?
Well, I just want to say that, we had some discussions when Candice was here. And because I'm part of the Caribbean Nurses Organization, we would be looking to see if at least my region would be able to pick up. And that's 6 countries, including Trinidad and Tobago, Guyana, Suriname, St. Vincent, Grenada, Barbados. So we would try to see if in the following year we would be able to collaborate with those other countries and do a joint program. It may have to be longer, might be a week if they have to come over, or we may have to go online. So we'll be able to dialogue and decide which would be the best way forward so that we can really incorporate all this information so that the nurses of the Caribbean Sea would be able to, benefit.
Oh, Candace, I don't know about you, but my heart is just overjoyed. I really am. This is wonderful. Wonderful.
Yes, we really have to give a big shout out to Avion for just being so
Yes.
instrumental in this collaboration
Yes.
to make it flow so smoothly, make sure that we were safe in the country, being that we are foreigners and unique, but also to make sure that everything was arranged and coordinated. So really a big shout out to the Trinidad Nursing Association and looking forward to like future international collaborations with them because I really see an extensive Caribbean collaboration or coalition with AWHONN and the potential to really get the material out there across the Caribbeans, which has a very strong nursing association, and Avion is actively participating in it.
And I also want to say thank you, Avion, not only for the ability to get all this situated, but just welcoming us into your home, right? That is your home, born and raised, and being so generous. The food was phenomenal. I'm not going to leave this
Yes.
podcast without saying I think I came back 20
Yes.
pounds heavier because every day, every morning, they provided us with great meals and great opportunities to learn more about their country, but even more about how they practice. And I know we did not share, but they have a wonderful post delivery program that every last one of
Yes.
the women are able to follow up and be seen by a provider and working with different individuals if they're battling substance use or whatever need that they have. I forgot the name of the clinic. Avion, do you recall the name of the clinic you
The
took us?
MIST.
Say it again. I'm sorry.
MIST. I can't remember
Okay.
what it stands for, but it's the MIST where they check all the mothers within 2 weeks after delivery.
Yes.
Yes.
And they're able to
And
get
they have,
follow-up care up until like 6 weeks or something. They're able to keep coming back, but just doing some remarkable things to ensure that the women there and the families, right, are getting the appropriate structure and care that's needed. So I commend you all for the great work that you're doing there.
Yes, and I agree with
thank
everything
you.
Ashley and Candace said because, and I love their bliss that has to do with breastfeeding. That was amazing. The whole outreach around breastfeeding was like phenomenal. I feel like they do an amazing job with really promoting breastfeeding, the postpartum care, the postpartum follow up was amazing. I just I can't keep talking. I can't not talk about it. I talk about it all the time at work because I feel like this is our vision for the United States as far as postpartum care. And Trinidad has nailed it. They have nailed it. And we need to take lesson from them.
Wow, thank you all so much for this entire discussion. I want to start with you, Candace, and just say I greatly admire how you came away from the painful experience of losing your cousin and you combine that with your love for her and your passion for nursing excellence, and you used your expertise and your training And that led to this collaboration with Avion and the Trinidad and Tobago Nurses Association. But you also brought together an amazing team. And so it's our pleasure to highlight your work on AWHONN Insights. And along with your team, we hope that the 32 clinicians that were trained by you all, that they have many more positive maternal and child health outcomes due to their experience. And then Avion, it's encouraging to hear the list of procedures that the clinicians now are advocating to perform. So we look forward as well to highlighting more training trips and experiences that come out of obstetric patient safety and AWHONN Apex, because you all have just spent the last few minutes telling us how much you learned, how you're going to approach your teaching here in the U.S. differently, and how the exchange of ideas benefits your nursing practice. So thank you all for being open and sharing, because I'm sure someone listening is thinking, hey, I can take this to my home country as well. So I know that Danielle is ensuring that our senior leaders hear your proposal, Kandis, for the international AWHONN branch and membership. And so thank you all again for joining us today. To all of our listeners, thank you for the privilege of your time. New about obstetric patient safety and AWHONN Apex, and we'll work to get more involved. If you re-listen to this episode, you can go to awhonn.org/podcast with an S. You can read our guest full bios. You can connect with them on LinkedIn. And you can utilize the resources that they talked about today. We're streaming on your favorite platforms. You can watch us on YouTube. And feel free to leave us a comment. Let us know what your listening experience was like. Thank you all so much. Be well and stay safe.